Good afternoon, everyone. It's really a pleasure to see you all here and also online. We are here for the EU-JAMRAI 2 Second General Assembly. And as you know, antimicrobial resistance is not selective. We all understand it spreads between human, animals, and the environment, highlighting that we are interconnected. That's why in Europe, scientists, doctors, veterinarians, farmers, policymakers, patients, and communities work together. This is the One Health approach. This is EU-JAMRAI. Today, we are entering uncharted territory with growing uncertainty about future policies all around the world. That is why the work we are doing is so critical. Every signature, every handshake is a promise to safeguard our future. Together, we all form the backbone of our collective effort. We are the backbone, the brain, and the heart of EU-JAMRAI. So, dear colleagues and partners, here and online, welcome to the EU-JAMRAI 2 Second General Assembly. I would like to thank all of you for attending this meeting, and especially the Austrian Federal Ministry of Labour, Social Affairs, Health, Care, and Consumer Protection for hosting us. Your presence today witnesses your ongoing commitment. And this morning, we also opened the exhibition Sketching AMR at the University of Vienna, and it was really a great event. But we will have occasion to talk about that later. To organize this meeting today, this General Assembly, these all 3 days, I want really to warmly thank the Austrian team, the always amazing communication team, and my precious and talented coordination team. They made a huge work in organizing these 3 days. So, over these 2 days of our General Assembly, we gather not only to share results, but also to celebrate how far we have come together. At this midpoint of our journey, we can already see how collective action across disciplines and borders is transforming AMR. We are also here to continue working through exchanges and brainstorming. So please do not hesitate to ask questions and share comments, whether you are in the room or online. You will also have many opportunities to discuss during the networking breaks around a coffee or a tea. And this is something new this year, that we have organized info corners during this break. So I invite you to visit these info corners to learn more and discuss with the leaders of the different tasks. I'm sure you will find many opportunities to implement in your countries pilot studies, training, mentorships, support programs. I let you discover that in the next session today and tomorrow. And on Friday, we will hold a stakeholder forum that gives stakeholders the opportunity to share their experiences and provide recommendations. But let's start today and with 3 welcome addresses. Before calling on stage the people who will give this welcome address, I have a technical, very important things to say to everyone. Never touch the black button. Never. You just go next with the green one and back with the red one, but never the black button. I don't know what will happen, but they told me never the black one. So if you do it, I will not be responsible. So let's start the meeting, and I'm very happy to welcome first the representative of the Austrian Federal Ministry of Labour, Social Affairs, Healthcare and Consumer Protection, Protection, I'm sorry, Mr. David Neumayer, Deputy Head of Department. Thank you very much. You have to stay in the middle.
So good afternoon from my side. It's a pleasure and honor to welcome you here on behalf of the Department for AMR and Healthcare-Associated Infections here at the Ministry of Health in Austria. Thanks for coming to Vienna. I actually want to introduce our State Secretary for Health, Ulrike Königsberger-Ludwig, which provided us with opening remarks in German. So afterwards I will translate the remarks. We can just start with it. Thank you.
Sehr geehrte Damen und Herren, ich darf Sie herzlich willkommen heißen zum Jahresmeeting der EU Joint Action Antimicrobial Resistance and Healthcare Associated Infection seitens des Bundesministeriums für Arbeit, Soziales, Gesundheit, Pflege und Konsumentinnenschutz. AMR stehen in enger Verbindung mit Healthcare Associated Infections und sind ein grenzüberschreitendes Problem. Deshalb braucht es in diesem Bereich europäische Zusammenarbeit auf Basis des One Health Ansatzes. EU-JAMRAI 2 setzt genau hier an, durch den Austausch, durch starke Partnerschaften und den Weg von der Strategie zur Wirkung. Heuer wird dieses Projekt unterstützt durch eine künstlerische Aufarbeitung aus ganz Europa. Ich wünsche Ihnen gute, konstruktive Gespräche und einen guten Aufenthalt in Wien.
So, thank you. She mentioned that it's very important to connect AMR and healthcare-associated infections to have, to have a collaboration internationally or in Europe on that topic, and to have like a joint action in this area. She also mentioned the Sketching AMR exhibition, which was opened today here in Vienna at the university, and she wishes us all the best for the meeting, interesting, informative 3 days, good discussions and networking. Thank you.
Thank you very much, Mr. Neumayer. Another thing after the black button for the speaker, stand here. or here with the crosses, but not everywhere. I know it's difficult because usually when I speak, I always walk, not that time. So stay here because it's very important for people online if they want to follow everything. So now we are welcoming the European Commission with first a message from Mrs. Sandra Gallina, Director General for Health and Food Safety at DG SANTE. And then after this video, we will welcome on stage Sigrid Weiland, Deputy Head of Unit for One Health and Antimicrobial Resistance at DG SANTE. So please, let's start the video from Sandra Gallina.
Good morning, dear colleagues, partners, experts and liaison officers. A heartfelt thank you to our Austrian hosts in Vienna and to the EU-JAMRAI 2 consortium for this General Assembly. At the European Commission, we understand that antimicrobial resistance is more than a priority. It's an urgent existential fight that concerns all of us. The silent pandemic claims thousands of lives, over 30,000, and it puts future generations at risk. We cannot accept a world where common infections become deadly again. That is why we fight AMR with unwavering determination. And this is why the use of One Health approach, taking into account human health, animal health, and the environment, is so important. We reinforced our original One Health Action Plan with a Council recommendation in 2023. As many of you know, this recommendation calls for various things, including stronger national plans, better surveillance, prevention, more awareness, prudence around antimicrobial use, and more ambitious targets. Now, how are we putting all these things, I would say, into practice? I would like to mention the recent political agreement of the EU on the pharmaceutical legislation, this big reform. Here we have introduced powerful measures like compulsory prescriptions, targeted information in leaflets, and a new AMR awareness card to get to a better stewardship. These things empower patients and professionals. They safeguard antimicrobials as life-saving tools across our union. This is how we fight antimicrobial resistance, by making One Health part of our rules. On the global level, the EU leads with resolve. We work hand in hand with the WHO, with our partners. We drive the global action plan. We champion One Health in G7 and G20 discussions. We raise awareness through European Antibiotic Awareness Day. And we support the World AMR Awareness Week. In this battle, EU-JAMRAI 2 is indispensable. Your dedication helps us work here in Brussels and turn policy into action. Better tools, better surveillance, more antimicrobial stewardship, resources and more evidence-based guidance, all of this supports member states in their action. We want to bridge ambition towards reality. You know, this is very important. Now, we are at a critical juncture. If we want to succeed, we need unwavering commitment at national level. So, the European Commission has provided the framework, the guidance and the political momentum. Now, the baton passes to you. This is why your success will be measured by how well you embed all these things I just mentioned into your national strategies, your budgets, your institutions. I mean, this is our shared duty. By turning tools into action, we can save lives, we can secure a healthier tomorrow. Together we can rise to the challenge. Let's make sure that antimicrobials remain a beacon for generations to come. And I would like to thank you for your commitment. This joint action is very precious, and I really, really wish you a successful General Assembly. Thank you.
And it's not my pleasure to welcome Sigrid Weiland. Thank you, Sigrid.
Okay, thank you very much, Professor Ploy. Thank you very much, Mr. Neumayer. Ladies and gentlemen, good afternoon. I would like to thank you very much for the opportunity to speak at this year's annual meeting of JAMRAI 2. For me, it's the first time, and it's a real pleasure to be here. I would also like to echo the words of my Director General, Sandra, Gallina, and warmly thank our Austrian hosts for welcoming us in the beautiful city of Vienna. For the weather, nobody's to blame. And also, of course, the coordinators of JAMRAI 2 and all the people who were involved in the organization of this great event. So let me start with a maybe obvious but still urgent message. The work that you are doing matters, and today more than ever. As Director General Gallina reminded us, the most recent data published by the ECDC on European Antibiotic Awareness Day last year draw a worrying picture. Europe is currently not on track for 4 out of 5 of the AMR targets set by the Council recommendation on stepping up the fight against AMR in a One Health approach. Since 2019, the estimated incidence of 2 bloodstream infections with AMR continued to rise. And since 2023 saw a slight decrease in antimicrobial consumption. In 2024, it increased again, moving us further away from the target of a 20% reduction. Meanwhile, the share of antibiotics from the WHO access group remained stagnant at 60%. Also in the veterinary sector, the most recent report on European sales and use of antimicrobials shows a 5% increase in sales for food-producing animals as compared to 2023. Overall, it is clear that we still have significant ground to cover before we can reach the 2030 targets. And all of this is happening in a context that does not make it easier for us. Climate change, environmental pollution, and geopolitical conflicts are all contributing to the spread and to the maintenance of antimicrobial resistance. Taken together, these trends leave little room for complacency. They confirm that continued and reinforced action against AMR is not optional, it is essential. And it must be collaborative, coordinated, and firmly grounded in a One Health approach. This is precisely why the implementation of the Council recommendation is so important, and turning this recommendation into concrete and measurable action requires the joint commitment of the European Commission, the Member States, and all of you in this room. In this effort, the role of the liaison officers is particularly important. We rely on you to bring the knowledge, tools, and lessons learned through this joint action to the attention of the right people in national ministries and institutions, so that they are translated into national strategies, policies, and budgets. This is how European ambition becomes national reality. With a total budget of 62.5 million euros, including the 50 million euros from the EU for Health program, and 128 partners from all EU member states, Iceland, Norway, and Ukraine, JAMRAI is one of the EU's most important instruments for putting the Council recommendation into practice. And it is already a tangible result. Through the EU-JAMRAI policy group, which brings together national policymakers every 6 weeks, a permanent space for coordination, peer exchange, joint problem solving has been created. At the same time, professional networks such as the European AMR surveillance networks in veterinary medicine and environment, and the AMR communicators network are enabling systematic exchange of best practices across sectors, strengthening a truly European and One Health response to AMR. Through mentor-mentee working groups, participating countries have identified their key AMR priorities and developed concrete national roadmaps. This is reinforced by the EU-JAMRAI support program for policymakers, which is already strengthening national capacity to design, update, and implement evidence-informed AMR policies. Together, these efforts are supporting the real-world implementation of One Health national action plans. Alongside its support to the JAMRAI, the Commission is already contributing directly to the implementation of the Council recommendation. Let me briefly highlight 4 examples. First, we are strengthening cross-border coordination. Through the AMR One Health network, we are enhancing dialogue and cooperation across human health, veterinary, and environmental sectors within and across member states, between EU institutions, and with stakeholders. Second, we are reinforcing surveillance and monitoring. In November last year, the Commission published a feasibility study on integrated surveillance for AMR and antimicrobial consumption across human health, animal health, and the environment. Third, we are investing in research and innovation. The Commission is contributing 75 million euros to the new One Health AMR partnership for the period 2025 to 2035. This partnership aims to align national and EU research efforts, boost innovation, and importantly, improve the translation of knowledge into practice. Fourth, at international level, we actively support the implementation of the UNGA political declaration. For instance, by engaging in the quadripartite AMR multi-stakeholder partnership platform, supporting the implementation of AMR One Health action plans in the low and middle income countries, in particular through the Multi-Partner Trust Fund, and by supporting the upcoming independent panel for evidence for action against AMR. Looking ahead, and it has been already mentioned by Director General Gallina, we are approaching a critical moment. In 2027, the Commission will report to the Council on the follow-up to the Council recommendation, including progress towards the 2030 targets. To prepare for this, a study will be launched this year to implement the AMR monitoring framework, which was published in 2024. This study will assess progress, identify possible gaps, and highlight areas where possibly further efforts are needed. This study will also include consultation activities, including with JAMRAI. Also this year, a new special Eurobarometer on AMR will assess programs of the public knowledge and behavior related to the consumption of antibiotics across EU member states. The outcomes and findings of JAMRAI will be an additional important element which will feed into this assessment. In this regard, we were very happy to see that the interim report of JAMRAI will map JAMRAI's activities directly to the objectives of the Council recommendation, which is very helpful. Demonstrating JAMRAI's added value will be essential, not only to measure the progress, but also for future financing decisions in a context of competing policy priorities such as European security, competitiveness, and climate resilience. In this regard, JAMRAI's success stories are a powerful illustration of what this joint action is already achieving on the ground. Tomorrow, we will see a session showcasing them, moderated by my colleagues from DG SANTE, Ivan and Kata. And I would like to conclude now, looking at the agenda of the coming days, from infection prevention to environmental surveillance, I see the full spectrum of what an approach to AMR truly means. The title of the first panel could even serve as a motto for this entire event and JAMRAI's work overall, accelerating and translating these into impactful AMR policies. That is exactly what JAMRAI is about and exactly what Europe needs. Of us, a very successful meeting and very much look forward to the discussions during the coming days. Thank you very much.